My name is Jess Paningasan. I was the first graduate of the fellowship training program for Pediatric Ophthalmology and Strabismus at the Philippine Children's Medical Center.
I'm Cess, and I am the second fellow in the PCMC Pediatric Ophthalmology and Strabismus program.
I'm Alvin Anthony Serrano, and I was the third fellow of the Pediatric Ophthalmology and Strabismus training.
Mary Basco, second year fellow of PCMC section of Pediatric Ophthalmology.
I'm Aldous Dominic Cabellas from Cagayan de Oro City, and I'm a first-year fellow in PCMC.
We're not just treating eyes, we're treating the children as a whole. Their vision problems greatly affect how they interact with others and how they perceive themselves. We should go beyond the diagnosis and see how their vision will affect their future and their lives.
Always be curious, and treat the patient as a whole.
It's actually humility. Coming in, the consultants, the hospital, the patients made me realize that I really had still a lot more to learn.
One, it's hard, but be resilient. It's all worth it in the end. Number two, love knowledge, be open to teaching, and at the same time, do active learning on your own.
How to confidently manage pediatric eye cases.
So what really stuck with me was for the days that I accompanied our consultants in their private clinic, because it left a lasting impression on me because uh, it's like um, it's like you're seeing into your future that this is what I'm going to do for the rest of my life, and that's when I realized really that I really love what I'm doing. Especially when I see my consultants in action.
First and foremost, consultant engagement, you can learn a lot by their experience, lalo na if the consultants are very active and very generous with their teaching, and all the more they just don't teach knowledge, they see and make sure that you learn it by experience. Number two is patient engagement. So in PCMC, we deal with a lot of different patients. We have a lot of challenging cases and challenging patients. So the skill of examining this kind of patients will be honed here at PCMC.
The hands-on surgical and clinical training.
During COs or whenever we present the case, also gives me an idea of how my mentors think and the process that goes through with each patient and each case.
The surgical training, seeing how these procedures greatly impact the lives of these children and their future made me choose this specialty. Being able to do those during fellowship reinforced why I chose this specialty. So my mentors during fellowship were very hands-on. They created an environment that was very encouraging for learning. They didn't mind me asking questions. Any mistakes that I made were turned into learning opportunities. I greatly appreciate that they gave their time and their effort going down every day to the OPD or to the outpatient department to see the patients with me. And seeing them in action helped influence how I see my patients now.
My bosses in fellowship would always encourage me to think outside the box, no? Not limit myself to literature, but look at studies, what's emerging, what's new, and be resourceful.
Consultants, they really taught me how to work under pressure, and they really pushed me to the limits and made me work under pressure. But after that, how diamonds are made under pressure. So here we are, shining like diamonds.
But first and foremost, they are very active in teaching you, and also they are very open in sharing their knowledge. So they make sure that you know it, not just theoretically, but also clinically, and they also see you through every step of the learning process.
Through close mentorship, guidance, and constructive feedback.
How to talk with children. Each child is unique. Some are shy, some are playful, some are anxious. This flexibility in being able to understand and adapt to each child helps me in building rapport, not just with the child but also with their parents, and it helps create a positive experience for the children.
Parang nilalabas niya yung pagka-leader mo or your leader potential because you're not only doing clinical work but you're actually doing managerial and admin work. Ito yung mga bagay na I didn't know that I could do, but through the fellowship program, I know now that I can.
So actually, it will take forever if I enumerate all the new skills that I've learned during the training program. Training program actually taught me patience because everything was new to me. Managing and diagnosing, managing an ROP, retinoblastoma, and all the other, strabismus and error of refraction, everything. So going into detail will actually be very, very futile. But in general, patience. It actually taught me a lot of patience. And I believe that my consultants were very patient on training me as well.
Because here at PCMC, we don't only see the eyes, we see systemic problems that involve the eyes. So the clinical education
Advanced pediatric ophthalmology, strabismus, and surgical skills.
Absolutely. Each child's treatment should be individualized because each child has different personality and circumstance, and so you should create individualized solutions for both the patients and their families.
Fellowship made me think broader, treat the child as someone who is a part of a family, someone who is developing and continue, and someone who is thriving in the world and trying to learn their ways in the world.
here, you just don't treat the eyes, you also treat the children in a way that you see how your medical concern will be adapted by the family in terms of their finances, in terms of their social and psychological status.
Yes, it taught me to think critically and put patients first.
The training was highly immersive and practical, from clinics to surgeries, from monthly conferences to presentations, in and out of the hospital.
Very, I would say very practical. So really from the time the patient enters your room, it's all yours and you will not lack support and you will not lack guidance, but you will feel the case relies heavily on you and you will learn from it.
It was a everyday hands-on experience. We are given opportunity to deal with the children on our own, but the consultants are there in each consultation to know if you are doing the right way and improving the way of your clinical examination and at the same time clinical decisions.
Very hands-on, with active involvement in clinics, surgeries, and patient care.
Actually, my training helped me in my private practice because of how practical and hands-on the training experience was. Actually, very lucky that each and every outpatient OPD day, there is a consultant who is actually in charge and very hands-on as well. So, but they're not always there hovering over us because they actually gave us a little space, a little independence. No, they gave us time to grow as well because I think that's how every trainee should be. We research, we read on the cases, and then actually, yeah, we can ask for confirmation from our consultants, or they themselves would let us know which part we should have done better.
So the fellowship taught me more than just knowledge and surgical techniques. It taught me how to think. I don't think any fellowship program can guarantee a trainee to see all possible conditions and to experience and try all surgical techniques. The fellowship taught me how to approach unfamiliar and complex cases using sound clinical reasoning and fundamental principles. Recently, I managed a rare case of a pulled in two syndrome, which I have not yet seen in during fellowship. Using the thinking that I was able to learn during fellowship, I was able to get a satisfactory outcome. So the lessons that I learned during fellowship continue to guide my practice every day.
Definitely helped me a lot. I've learned the subspecialty, doing the procedures confidently, and about leadership, being part of the team. I'm really proud of my training and Hopefully, we get to train more people and pay it forward.